We've created a clinical matron in each of our ward areas, and those clinical matrons work 80% clinically, and we aim that they'll be working to advanced practice level. The benefit is threefold. First of all, for the patient, that they will receive better care. Secondly, for our staff, in terms of recruitment and retention and support. And finally, for our clinical teams in terms of the way they work and a career escalator. Many of our other professional groups, so whether it's medicine or allied health professions, have managed to keep that clinical expertise but also to progress in terms of management and leadership. And what I wanted to do is to do the same for two reasons. A, because I think that we need to value the nursing and therapy expertise at a local level. But there's also something about giving nurses and therapists the opportunity to progress in their careers but to remain clinical at the same time.
Now having the recruitment trip on us on last week. So
at the start of the day we would talk about any pressures we've got in particular teams, you know, any staffing pressures within the medical team, within the nursing team, and there's a real opportunity of sharing of expertise, and we can manage complex situations, complex patients a lot better. It's definitely a safe environment where junior members of the team feel able to question. It's a really friendly, open team where we all work closely together.
How have you found the experience here?
Very good.
So from a ward point of view, I took over a ward which was struggling in terms of recruitment and also struggling in retention. The morale was very low on the ward. I managed to turn that around in terms of now we're fully recruited, and I managed to ensure that we have got a bank pool which supports the team on the ward. Take care, safe. Bye-bye.
how is he actually?
He is actually getting them.
I think I'd put a lot into training to be an advanced nurse practitioner and really enjoy that side of my work. But I also felt the desire to learn some management skills and to become a matron. I think I'd set myself the challenge to become a matron, and this allowed me to maintain my clinical skills whilst learning the management side of it and becoming a matron. Do you get any funny taste from these flushes?
No, I haven't.
I've managed to get a number of the nurses onto courses that they've wanted to do, and it's not to make everybody into nurse practitioners, but it's to show that there are skills that nurses can take on within their nursing role, not to become a mini doctor, but to become a maxi nurse.
And I've just sent it over to Enhanced Recovery so that they can practice for stairs with him and just check his mobility.
As the clinical matron for Frailty, one of the things I've tried to do is try and get those that work in the community to come in and build relationships with the team members working within the hospital environment. And the reason I've done this is I want those that work in the hospital environment to understand that actually these patients that we think that can't go home because they're not safe, actually they can.
Normally. I think that it's made a big difference because what she's done is made us work jointly with everybody rather than feeling that we are working here on our own.
So when you went over to the birth centre, what did you look at? Were you looking at the pools and the information?
Absolutely, looking at the environment.
I looked across the organisation at the clinical matron model and thought actually this could be central to the changes that I wanted to make in our service.
What we'd like to do is to encourage them.
Well, I feel the matron really is an enhanced role for clinical practice, but it maintains standards and it also enables the women to be at the centre of all we do. We need to be there as a problem solver some of the times, but also to help liaise, not just with the midwives, but also with the doctors that we work with. I'm working in the community, so I also work with the GP practices as well.
So what is absolutely key about the role is that what we're looking for is a clinical expert, and of course to be a clinical expert you have to be practicing, and what our aim is that our clinical matrons work 80% clinically and then they're supported by other people in the ward team to make sure that they can do that.
We've got a very experienced clinical matron who gives us great guidance. I'm an experienced nurse, and as I say, we've got 3 deputy sisters again who are very experienced, means that I can concentrate on the education. That helps with retention because people want to have challenges, they want to have different roles, and that is something we look at with the support of my brilliant deputy sisters who are fantastic as well and support that hugely.
The ward sister is an equally important role that we wanted to maintain. And so what we've got is not only a career escalator for nursing and therapy staff as they go through their career to remain clinical, but what we also have is that we have a great team.
So the benefit for the medical staff of working with senior matrons is that to properly look after the needs of our patients frequently requires a whole multidisciplinary team, of which the key really is the leadership of nursing.
Our consultant colleagues are hugely respectful of our role. I think we've been encouraged to pair up with consultants and learn from them and they from us.
So we specialise in looking after older patients.
I think the matrons are excellent advocates for the patients. They challenge when things are not happening that should for our patients. And we're trying to make sure that their time in hospital is valuable, and we are making sure that things are happening to benefit the patient every day.
And we'll try and get hold of one of your family members.
Clinical matrons have had a massive impact on my work. At managing a large area, it's important that you have people in the right place at the right time, and they provide real leadership and ownership of our wards. They make sure we're safe. They make sure that our staff feel supported, and they also make sure that we give excellent patient care.
I can only say that the whole ambience of the ward, from first being introduced, even before I came as an inpatient, was one of attention to detail and care. To see her round and about as a hands-on clinician, I find it very reassuring, and I'm sure the staff must feel that.
Feedback's been amazing. The clinicians, whether they're therapists or nurses, love being in a senior position where they have autonomy, but they can remain clinical. And then secondly, our patients love having a senior clinical expert that they can go to.